Good morning. I want to introduce myself. I'm Dan Martin from Ohio ACEP. Currently, I'm the program director and the vice chair of education at Ohio State University, but I also am the chairman of our education committee for Ohio ACEP. And today it's truly an honor and a privilege and a pleasure to introduce to you the editor-in-chief of our next edition of the Carol Rivers textbook in emergency medicine, and that's Dr. Amal Mattu. So really, really great to have you here. That edition, by the way, is coming out in January of 24, so just right around the corner. Now, I've known Dr. Mattu for a long time. I know we've both used this text over the years to prepare for our board exams and things like that. But I also want to just tell you a few things. If you don't know about Dr. Mattu, I'm shocked, but I just want to emphasize a few points about him. I hope I don't embarrass him too much, but he's a tenured professor at the University of Maryland. And here's a few bullet points to share about him. He's approaching 30 years of practice in emergency medicine, and nearly all of that time has been really devoted to education, which I am totally honored, because I think I'm of the same view that education is one of the most important things we do. But during that time, he's been a residency program director, he's been a fellowship director, he's been the vice chair of education, now he's the vice chair of academic affairs, just to name a few of the many leadership roles he's had. If you happen to look at his CV, it's pretty soon it's going to be more pages than the Rivers textbook. It's already approaching 150 pages long, with too numerous to count awards and recognitions. And between his peer-reviewed publications and other scholarly works, he's approaching 200 pieces of scholarship. But I got to tell you, my favorite thing about Dr. Mattu is he has delivered so many impactful lectures about so many clinical and non-clinical topics. And those are some of the best lectures I've ever enjoyed. So if you haven't been to these lectures, you really need to. But I got to tell you that perhaps the most important thing about Dr. Mattu is, and this is what I want you to all realize, especially being from Ohio ACEP, is Dr. Mattu was born here just north of Columbus at St. Anne's Hospital. So we're going to claim a little bit of his origin and things like that from Ohio. So, but his contributions to emergency medicine have been just so impactful. So great to have you here. So before we get into some of the questions, any general comments you want to make about this 11th edition that's coming up?
Well, sure. First of all, Dan, thanks so much. That was a really, really generous introduction. I think my mom probably wrote it, so I appreciate you reading it the way she wrote it. Anyway, I'm real excited about this upcoming edition of the Carol Rivers text. It's, as you mentioned, something that we both have used. Many people have used. I used it in my residency. I read through it when I was a second-year resident. I read through it again as a third-year resident, and it made such a huge difference in my ability to work as a resident and then subsequently. And also, when I was prepping for my first-time certification and my research, I've consistently used it. So it really is a hallmark text in emergency medicine. And so it's been such an honor to finally be a part of it, because it's given me so much along the way.
Well, thank you for those remarks. You have been so prolific in writing a number of textbooks, academic papers, all really to help learners in emergency medicine as well as educators. So when you reflect on this edition, what are you most proud of with this upcoming 11th edition of the Carol Rivers text?
Well, I think we've streamlined it a bit. We've cut out some information, a decent amount of information that we didn't think was going to be really relevant to the boards. So it really is a nice user's manual for those people prepping for the boards. But we've added a lot of really useful clinical information as well. Of course, the big addition over the past few years is a lot of information about COVID, but there have been a lot of new guidelines, not a lot of new clinical policies from ACEP, and a lot of practical tips about practicing emergency medicine that have been added as well. So I think it's a really great board review, but it's also very, very nice for just improving your clinical practice. And unlike many other textbooks out there that are really, I don't know, meant a little bit more to just sit on the shelf because they've become too big to actually read cover to cover, we've been able to maintain Carol Rivers at a reasonable size so that it really is a book that you can read cover to cover during the course of a year in residency, or during a reading curriculum, or during your free time when you're prepping for the board. So I like the size, I like the content, I like the efficiency of the content, and also that we've been able to get rid of stuff that is not going to be helpful and add a lot of stuff that really is going to be helpful. And the authors have just done a fantastic job. So you ask what I'm most proud of, and it's kind of that combination of things.
You know, if you look at, this is an 11th edition, and so there's been a lot of previous editions. Ohio ACEP has sort of been known for prepping for exams and boards, and we've had back in the day, large courses, and you've been a lecturer in many of those sessions. What do you think? And you touched on this already a little bit, but how do you feel the 11th edition has maybe been improved compared to the 10th and the 9th? You mentioned a little bit about it, but I guess maybe you could re-mention some of those things, I guess.
Sure. Well, it is really tough to improve on such a great book. You know, Ann Dietrich had been the prior editor-in-chief just before me, and is just an incredible educator herself, a really wonderful person. And I think she had taken the Carol Rivers text when she took over as editor-in-chief. She had taken it to a new level as well. And so what we've really tried to do is just really stay on top of the literature that people need to know. Again, as I mentioned, with clinical policies and guidelines, and continue adding those. And we've really taken a close look at not only what people need to know for the boards, but also what people need to know for their clinical practice, and infuse that into the boards. We've streamlined the flashcards that people can use for studying as well. And like I said, I think it's become a really great text, not only for board review, and I think it's probably the best text that's out there for board review, but also just as kind of a user's manual for junior level residents and faculty to read, to really stay on top of what they need to know for their clinical practice.
Yeah, I know the flashcards. My experience with those too is I would actually take those to work, and sometimes, you know, at slow times, things like that, make sure I ask residents questions from the flashcards, things like that. So I think for even for attendings, there's lots of uses of this text as well as the flashcards. There's a lot of preparations out there for boards and for ITEs. Man, question banks, things like that, the peer exam. How do you think this fits in to a resident as they're trying, or a resident or a learner, they're trying to think where should I use this? How should I use it compared to those products?
Well, there's definitely different learning styles, and there's some people out there that seem to do best by just going through a lot of questions. And so we've made sure that the Carol Rivers text does have a lot of questions. There's questions at the beginning of every chapter that people can use to figure out where their areas of weakness are. There's kind of pre-test and post-test sets of questions. And so for the people out there that really love questions, there's a lot that are going to make you happy. But I was always the kind of learner who got a lot more from actually reading about things rather than the questions. And so that's, I think, where the text is really strong. And for those people that are question kind of people, when you find an area of weakness because you're not answering the questions correctly, you don't have to go searching for the answers. The answers are right there in your hands in those pages of Carol Rivers. So I think it very nicely meets multiple different types of learning styles, whether people like reading something or people like just doing questions, people like testing themselves. You mentioned the flashcards. and I find that useful as well. During 5 minutes here, 2 or 3 minutes here or there, you just pull those flashcards out and you can review things. If you're an attending, they make for very nice questions to ask the residents, and they don't know where you're getting these questions from. So I would keep these cards in my pocket, and when they've got their back turned, pull them out, look at them real quickly, and then ask them some questions. So it really does meet a lot of different learning styles, and I think that's one of the really nice things about the Rivers text.
Thanks for that. When I look at the list of authors on the text, boy, there's some great names out there. Can you maybe speak to the expertise of the authors and some of the other people that edited some sections of the book and maybe their approach to writing the chapter kind of under your leadership?
Sure. So we have switched out a handful of authors, and I think the prior authors did a fantastic job. But in our effort to try to maintain an up-to-date text, what we wanted to do was really focus on content experts in emergency medicine. So, for example, who is the real expert in hem-onc emergencies? We went out there and we picked somebody like Sarah Dubbs, who is a national expert in orthopedic emergencies. We went out and we picked Michael Bond, and there's a handful of other people that fit the bill also. So we tried to get people that are experts in their field, not just people that are willing to write a chapter, but people that regularly write about and lecture about those specific topics. So they are experts in their field. And the other thing is that we didn't want no offense to the researchers that are out there, but we didn't want people who are primarily researchers. We wanted people that are content experts who are primarily teachers, because it is intended to be a teaching type of text. So I think what you'll find is that the authors are not only experts in their relevant fields of chapters, but they're also well known to be excellent educators, and they're able to combine their expertise and interest both in their field, their section, with also expertise as teachers. And I think you'll find that as you read through the text, it really is a teaching manual rather than something that's just going to teach you about esoteric stuff that you might find in research manuals that you really don't need to know either for clinical practice or for the boards.
So let's say that you are we convert all the 200 and some residency programs into one residency, and you are the program director. How would you advise residents or people just out of training, whatever? How would you say they should use this text as they study for exams and things like that?
Sure. Well, actually, this is exactly what we do in our residency program. Prior to the in-training exam for a few months, what we do is we take the Carol Rivers text and we make that the reading curriculum. And so for those few months leading up to the in-training exam, all of the readings that the residents get are assigned chapters from the Carol Rivers text. During the other 8 months of the year, there's different readings. There's journal clubs and there's cutting-edge review articles and such. But the idea is the residents every year are taking a board review course that leads up to the in-training exam. So by the time somebody finishes our 3-year residency program, they've taken 3 board review courses, all based on Carol Rivers. They go through the questions, and the result has been that the in-training scores are outstanding, and also the residents have a copy of the Carol Rivers that they're able to continue using in preparation for their board review exam that they take, I think, in November following their graduation. So what I would recommend is exactly what we do. And we just create a reading curriculum focused on Carol Rivers during those few months of the year. And the nice thing, again, as I mentioned about Carol Rivers text, is that it's small enough that you can actually do that. You wouldn't be able to do that with some of the other textbooks that are out there. There's no way you could go through, I'm not going to mention names, but there's no way you could go through some of the textbooks that are out there within a 4-month period of time. You would be forced to go through those textbooks over the course of an entire year. And that's not what we want to do. We want to make our reading curriculum cutting edge, but also relevant to the board. So we split our curriculum up like that. 8 months of the year, it's cutting edge stuff. Oftentimes that might not be on the boards, but then 4 months of the year, it's very dedicated, hardcore review for the boards. And then as soon as the in-training exam is over, we go back to the rest of the curriculum. So it's very nice for the residents. 3 times during their residency, they get a board review course.
That's outstanding. Well, I really appreciate you taking time out to be with us today. Just to remind everybody, the release date of the new 11th edition of the Rivers text is going to be actually January of 2024. So stay tuned. You can find out a lot more information on the Ohio ACEP website. Thanks again, Dr. Mattu.
Thanks, Dan. Look forward to talking to you again.